Hi, I'm Dr. Rob Noecker here in Fairfield, Connecticut, Ophthalmic Consultants of Connecticut with Dr. Jim Thimons. And today we're going to talk about the patient with ocular surface disease and glaucoma.
Ocular surface disease has been a integral part of refractive and cataract surgery for at least the last decade. A great deal of attention has been brought to its impact on surgical outcomes, visual performance. In the glaucoma space, it's a much more recent arrival. In the last 5 years or so, we've seen a marked uptick in the awareness of clinicians as to why the ocular surface is important, and then additionally, how it can impact both the visual and the quality of life outcomes of the patients being treated, and maybe more importantly, downstream, how it changes outcomes in ocular surgical intervention.
I agree with Dr. Thimons. So I think what's changed is a growing awareness, because once again, it's been more obvious in the areas of cornea subspecialties. But as it happens that these patients tend to run together. The older demographic makes it more likely you have glaucoma. It also makes it more likely you have ocular surface disease. And there's a number of prevalence studies which have demonstrated that patients with glaucoma have a higher rate of ocular surface disease, or higher than the general population. And there's probably a few reasons for this. Number one, what we do in terms of therapy, and we'll talk later about this, probably makes a lot of ocular surface disease worse. And also, these patients are just more prone. The patients who are more prone to have problems with therapy probably already have pre-existing ocular surface disease. But now we have new technologies both to help us diagnose, and if we find the patient with ocular surface disease, we can change or kind of modify our treatment algorithm to better customize it for that patient who's more likely to have problems.